Oral sex is a common and intimate form of sexual activity that involves stimulating a partner's genitalia with the mouth, lips, or tongue. While it can be enjoyable and pleasurable for many individuals, it's essential to consider both the risks and benefits associated with oral sex. Benefits of oral sex: intimacy and pleasure. Oral sex can enhance intimacy between partners and provide intense sexual pleasure for both the giver and receiver. Variety in sexual experience. Adding oral sex to your sexual repertoire can introduce variety and excitement into your sex life, enhancing satisfaction and fulfillment. Foreplay and connection. Oral sex can serve as a form of foreplay, helping to build arousal and emotional connection between partners before engaging in penetrative sex. Orgasmic potential. Many individuals are capable of experiencing orgasms through oral stimulation, offering an additional avenue for sexual satisfaction. Safe alternative to penetrative sex. Oral sex can be a safer alternative to penetrative sex for individuals who want to reduce the risk of pregnancy or sexually transmitted infections, STIs. Risks of oral sex. Sexually transmitted infections, STIs. While the risk of STIs may be lower with oral sex compared to penetrative sex, it's still possible to transmit infections such as herpes, gonorrhea, chlamydia, syphilis, and human papillomavirus, HPV, through oral genital contact. HPV and oral cancer. Certain strains of HPV can be transmitted through oral sex and may increase the risk of oral and throat cancers. Genital herpes. Oral genital contact can transmit the herpes simplex virus, HSV, leading to oral herpes, cold sores, or genital herpes. Risk of HIV transmission. While the risk of HIV transmission through oral sex is relatively low, it's still possible, especially if there are open sores, cuts, or lesions in the mouth or genital area. Hygiene concerns. Poor genital hygiene can increase the risk of bacterial or yeast infections, particularly if oral sex involves contact with the anus. Safety precautions for oral sex. Communication. Open and honest communication with your partner about sexual history, STI status, and preferences is essential for practicing safe oral sex. Use protection. Using condoms or dental dams during oral sex can help reduce the risk of STI transmission, especially for oral vaginal or oral anal contact. Regular testing. Getting tested for STIs regularly and encouraging your partner to do the same can help identify infections early and reduce the risk of transmission. Avoiding risky behaviors. Avoid oral sex if you or your partner have open sores, cuts, or lesions in the genital or mouth area, as this can increase the risk of infection transmission. Hygiene practices. Practicing good genital hygiene, including washing the genital area with mild soap and water before sexual activity, can help reduce the risk of infections. Ultimately, the safety of oral sex depends on various factors, including the sexual health and hygiene practices of both partners. By understanding the risks and taking appropriate precautions, individuals can enjoy the pleasures of oral sex while minimizing potential health risks.